Hi, my name is Traugh, and I go to Arkansas State University-Beebe. Today I'm doing a persuasive speech over teen pregnancy. Did you know that about 1/3 of girls in the United States get pregnant before the age of 20? According to Guttmacher Institute, 82% of those pregnancies are unplanned. The United States has the highest rate of teen pregnancies than any other high-income nation. Although the rate of pregnancy in girls from ages 15 to 19 has gone down, it's still extremely sobering to learn that 43 out of every 1,000 births were born to teenagers in 2002. Babies born to teenagers are more likely to have birth defects and low birth weight, not to mention that teenagers are less likely to get prenatal care, seeing as how they are so scared to tell their parents that they wait until there's no other choice. When a young girl gets pregnant, she might not know the possible dangers to her baby, such as smoking, extreme activity, alcohol ingesting, and stress. That puts the baby at even more risk for fetal alcohol syndrome, miscarriages, and birth defects. 29% of pregnancies among teenagers will end in abortion. Teenage girls are more likely to have an abortion because they're scared to have a baby, their parents force them to, or they know that they're not capable of caring for a child or affording it. There were 214,750 abortions by teenage girls in 2002. That's 214,750 babies that weren't born because their mothers were still children themselves. Most girls that get pregnant also don't want their lives to change to the point of there being somebody else in their life that's more important than them. When a young girl becomes pregnant, life changes as she knows it. There's no more going to the mall with her friends, no more wearing the hottest name brand clothes, no more staying with a friend at a friend's house for the weekend, no more parties, and possibly no prom or high school graduation. According to Cheryl D. Hayes in Risking the Future, risks and complications throughout a teenage girl's pregnancy are more likely too. The risk of miscarrying is higher in young girls than normal. There's a bigger risk of low birth weight, premature deliveries, and maternal mortality, meaning that the child having a child could die during pregnancy or delivery. Girls that become pregnant at a young age have a harder time throughout their lives. High school graduation is highly unlikely. Most girls didn't have the support or ambition to finish school after having a child. College is nearly impossible. I can tell you that from personal experience. I'm going through college with 2 small children myself. Then these girls who possibly didn't finish high school, and most likely didn't go to college, have a lower standing in society and live in poverty. Most girls that have children before finishing high school are the same girls standing in line to get their food stamps every month, and are only able to pay their bills because of welfare. We must fix this problem. But how? Sexual education is already being taught in school. Contraceptive use has already become popular among teenagers, and the rate has gone down from that, but not enough. I think we should teach the kids not only sexual education, but risk of pregnancy, personal stories from girls that have gotten pregnant, such as myself, and outcomes of not having a child before being financially ready, emotionally ready, and physically ready. How can we expect life to be better for our children if we cannot properly teach them and guide them to adulthood with proper education and proper childhood? Yay!